All right, thank you we're sorry we're a little bit late with our media briefing today. We don't appear to be streaming on YouTube right now. I've called for technical assistance, so bear with us, but we're going to go ahead and get started with our speakers today since it's already afternoon, and hopefully we'll resolve the issues that we do have. We're going to start with our CAO, Charles Mckee. Good afternoon, Charles.
Thank you, Maya. Sorry for the technical difficulties, and I apologize I don't have the skills to assist. There are limits, so I appreciate the opportunity again to speak to the media and to any people that the media is able to push this out to. I'm sorry that we don't have. Oh, there it just popped on recording, so maybe YouTube has it up. I wanted to start off with a kind of recognition of the events that are unfolding in the country. That separate from COVID-19 and the novel coronavirus. I think as everyone is aware, there has been a lot of injustice and unequal treatment for far too long in our country for minorities and particularly African Americans. And we need to recognize that that we all need to have a role in changing and making change. And that every time we think that that we've turned the corner in creating equality, or at least getting closer to equality, we seem to have a setback, or at least some evidence of the fact that we're not as far along as we thought we were. We know that there are often times out there when a cell phone camera is not going to catch the injustice that is occurring, and so that's probably happening all too often, or know it's happening all too often, and we just have to recognize that it is time for all of us to step up and make our voices heard and make the change that we know needs to happen and happen now. So I'd appreciate that the media continues to get that story out and recognize that while there might be some inappropriate behavior out there, that the right to protest is enshrined in our Constitution, and it's one that we take dearly and should support dearly. And we think that message is really important to make the changes that we think are needed in this country right now. We have to overlay that situation with what's happening with the coronavirus, the novel coronavirus and COVID-19, the challenges that we already face in this country and around the world with COVID-19. And the good news in many senses that we're looking at ways to open up our economy and our businesses in a safe and prudent manner. And of course, that all can only continue if our public feels safe frequenting businesses and frequenting government offices and going about their lives. And that safety and feeling of security is only going to occur if we can keep the numbers low, and if we can have really good compliance and self and community responsibility. The responsibility to is not just to yourself, it's to your fellow human being, to try to make sure that there isn't a spread to someone else. And I know you've heard it, and I know everybody has heard it, that the reason to wear a facial covering or continue to wash your hands or have the physical distancing is potentially to save someone else and potentially to prevent someone else from being sick or getting injured or potentially dying. We know that the coronavirus originally was looked at as something that only the aged or infirm were getting. Our numbers here locally show that the vast majority of the new cases are seen within our vibrant population of those folks who are not Asian and not super young. Those are the people that are out in the workforce and have to do the daily jobs that we're asking them to do, to service in the restaurants, to pick in the fields, to work in stores that we're frequenting. And so we know that the spread is not limited to those who are just older, and we know that the risk to people's health and lives is not just limited to somebody who's older or infirm. We also know now that, and I'm stealing probably a lot of Dr. Moreno's talking points of thunder. We also know now that it spreads to the young, that it can spread to infants, and it can spread to young people. And while most of that's happened on the East Coast, we know that it's likely to happen here on the West Coast too. So the vigilance is important to make sure that we're protecting everybody and having the right responsibility for our whole community. With that said, the opening that we've seen in our economy here locally and across the state has been significant. We hope that it's done in a manner that will allow us to continue to some sense of return to normalcy. But we also know that we have to keep tabs on the numbers. We know our numbers have been going up a bit, and I know Dr. Moreno will speak a little bit about that. And some of that has to do with some of the family type gatherings that have happened on Mother's Day. We don't know about all about Memorial Day yet, but if the pattern holds, there might be some increased numbers surrounding Memorial Day. Of course, Father's Day is coming up, and then potentially, then July 4th will come up and potentially have some additional issues there. My message is one that is that we should be hopeful and excited about opening up our businesses and our economy and recognizing the hurt that people have had who have lost their jobs, and be thankful if you continue to have a job. And frequent businesses if you can, and do so in a way that is safe for everyone. So with that, I will turn it back to Maya and appreciate any questions or comments as we move forward.
All right, thanks very much, Charles. And our first speaker on the lineup today is Diana Jimenez from our Department of Social Services. We have had her on the briefing before talking about the Great Plates Delivered program, and she has an update for us this afternoon. Hi, Diana.
Hi there. Good afternoon, everyone. I'm Diana Jimenez. I'm the Deputy Director over Adult and Aging Branch Services in the Department of Social Services, in addition to the Deputy Director over the CalWorks Employment Services branch of Social Services. But today I'm sharing with you what I hope is some good news. After 3 weeks time frame, which seemed like an eternity, we were able to get the Great Plates Delivered program here in Monterey County. And as a reminder, this particular program has two purposes. One is to help seniors and other adults at high risk of COVID-19 to stay home and stay healthy by delivering them 3 nutritious meals a day. And the second goal is to provide essential economic stimulus to local businesses struggling to stay afloat during the COVID-19 crisis. As of Monday, we have confirmed 101 participants that have enrolled and are eligible for the program. We have had assistance from the 211 and United Way to help screen participants for this program. We are in the process of contacting eligible participants to inform them that the program will begin later this week. And we're also trying to map out where they live so we can assign them to a restaurant that has been selected throughout the county to better serve them. The restaurants will deliver 3 meals, a meal kit of breakfast, lunch, and dinner. We had over 76 businesses that submitted an interest at the state level. Of those, about 25 submitted local applications, and of those 19 completed all the paperwork and submitted what we needed to review and score and assess. We had a diverse panel that helped with the selection process. So we were able to select 6 restaurants for the Great Plates Delivered program at this point throughout Monterey County. We looked at geographically where the participants were spread out, and again ensured that we had restaurants selected in all the geographic areas. So we have a restaurant in Salinas, Prunedale, Gonzales, King City, Monterey, and Marina. As we speak, the fiscal staff is working on completing contracts with these restaurants and needed agreements so we can start serving seniors. Again, the goal is this week, and hopefully by Thursday, Friday, some of the meals will start to be delivered. Should we have an expansion, and I'm hoping we will, of Great Plates delivered participants that qualify for the program, then that will enable us to help a few more restaurants. But right now, with only 101 participants, we're only able to assist 6 restaurants. And that's all I have.
Thank you, Diana. That's some of the great news for the day. And please stand by for questions after our other speakers. We're also asking, we've also invited Sarah Sturdivant from Department of Social Services to join us on the briefing. This is not a topic that is specific to COVID-19, but it is a topic that is less looked at in the Social Services Department and some of the services that they do. And she's going to talk about an award that her division got for their work improving the outcomes for LGBTQ children in the foster system. Sarah, are you with us?
Hey, I'm Sarah Sturdivant. I am a management analyst and I work in family and children's services. Over the last year, we have worked as a division to become an affirming LGBTQ agency. And a piece of that was developing our sexual orientation, gender identity, and expression policy, which we call SOGI as an abbreviation. And so that was one of those long-term projects in order to create a comprehensive process that covers all aspects of how our families interact with child welfare. So from the hotline call, if somebody calls to report suspected child abuse, to how our emergency response responds to those calls, how we screen families who become our resource families. We interacted with our court, which is also interested in being an affirming agency or an affirming court when LGBTQ families and children are present in their courtroom. And then we also made certain that once our families are a part of our process, that we're looking at the whole person and the reasons why that this child may have entered care. So that includes our reunification. So as we're working with families to reunify. So if the reason that the child was removed was related to family rejection because of the child's LGBTQ status, that's an opportunity to work with families to become more accepting of their child and to return those children back to their families in a safe way. And if we aren't able to do that, finding affirming foster families who are willing to provide that care and support. So we talk about different levels of how we operate as a agency. Affirming is sort of beyond acceptance, and it's way beyond tolerance. So I sort of think of tolerance as the basement, like we all sort of are able to tolerate each other to get through the world. Acceptance is the next level of sort of, okay, I accept that you are different than I am, but that's okay. And then affirming is really a celebration of our differences, and especially of LGBTQ identities. And that was our goal, was to become that affirming agency. And so we were recognized by the Human Rights Campaign, which is a national, the Human Rights Campaign Foundation, which is a national LGBTQ advocacy organization that does both political lobbying as well as education. And so we have happily been able to be recognized at their highest level, which is an innovative or innovator agency. And we were also recognized at the second tier, which is building. So we did an extensive self-assessment and training and professional development process in order to receive this recognition. And we are very excited to have accomplished this as an agency.
Thank you very much, Sarah, for that comprehensive look, and congratulations on the honor. Please stand by in case there are any questions from our media partners. And I see we have Dr. Moreno, who has joined us on the briefing. We're always glad to have him when we can get him. Dr. Moreno, do you have any updates for us today?
Hi, Meg. Good afternoon. So, yeah, Ed Moreno, Monterey County Health Officer, and I don't have any particular updates that Charles Mckee didn't already touch on. but I'll just make a couple of points. One is that we continue to make changes to the format of the data that's on our webpage. And we also are looking to try to refresh the data earlier in the day. So we're still working on that. The other thing is there are increases in cases here in Monterey County. The doubling time continues to be between 3 to 4 weeks, which means that there's still some bit of slowing of the virus here in Monterey County. But we have seen new cases of COVID-19 that were linked back to family gatherings for Mother's Day, for Memorial Day, and other family celebrations. So it's really still very important to remember that social gatherings, even with your family, pose a risk for exposure to the virus. Also, that some people who are infectious do not have symptoms. And so it's very important to try especially if you're older, to stay home if you can, and wash your face, wash your hands, frequently, cover your face when you go out in public. But other than that, Maya, I think Charles covered just about everything.
That's great. So that being the case, then I'm going to go ahead and start with the questions. And we'll start with you, Dr. Moreno. I'm glad you're here. What phase are tattoo shops expected to open in? And what are some of the risks of opening these shops during the pandemic?
Sure. So my understanding is that the tattoo businesses are scheduled by the governor and the state health officer to open in stage 3, and we're currently in stage. We're completing stage 2. Some of the concerns about tattoo parlors is that in providing the service, the individual really has to be within 6 feet of the person receiving the tattoo, and so. And tattoos take a while, so the sessions are typically longer than 15 minutes. So if someone is applying a tattoo and that artist is infectious with COVID-19 with or without symptoms, and they have been with that client for more than 15 minutes, then that client is considered a close contact and would have to be in quarantine. So I do recognize that the tattoo industry worked very closely with health officers several years ago to develop new standards for protecting the clients against bloodborne pathogens like HIV and hepatitis B. So we as health officers are still very grateful for the industry having worked with us on that. But another difference here is that the virus that we're talking about isn't a bloodborne pathogen. So all the precautions that they take will prevent hepatitis B and HIV transmission. But this is aerosolized. It's a respiratory illness. And so it's the breathing in close proximity to someone who's infectious that puts someone at risk of COVID-19. And likewise, the clients if they come in with COVID-19 with or without symptoms, and the artist could become exposed and be considered a close contact and would need to quarantine following that exposure. So there are other sectors that have a somewhat similar situation where the person providing the service is in close contact with the clients, such as barbers and hair salons. But the governor and the state health officer did make the decision to go ahead and move those from stage 3 to stage 2, and so those are operating with some with modifications.
Thank you, Dr. Moreno. And another question for you. Are large events such as the Big Sur Marathon only allowed once a full publicly available vaccine is created?
So we are definitely we as a nation are working towards developing vaccines, and there's several underway. So when a vaccine is available, that will definitely oh, and people receive the vaccine. So that's the other thing. Just because it's available doesn't mean that we're good to go and back to normal. People actually have to step up and receive the vaccine. And it has to be a vaccine that has been shown to be effective at providing immunity to specifically COVID-19. So when all that happens, certainly things will be easier for us as a nation to resume or remove some of the modifications that we have in the businesses and activities that are currently allowed. The timing, though, I don't know when that's going to happen. And so I can't answer the question as to whether or not large venues like events that you just mentioned are going to happen with modifications before a vaccine or only when a vaccine is available. So I don't have the answer for that.
Thank you. And another question, this one on testing. With free testing being provided to the community, are all the jail and prison inmates going to be tested at facilities across the county? How many kits would be needed for such a project?
Yeah, I'd have to defer that to the sheriff and the local prison down in Soledad as to whether or not they're going to be doing what I think you're referring to, Maya. The question is surveillance. What I can tell you, though, is that wasn't part of your question, but what I can share is that the skilled nursing facilities are required by the state, California Department of Public Health Licensing and Certification Division to establish surveillance plans in which they test the residents and the employees on a regular basis. So that is starting now, and what we do expect is that due to that surveillance, we will find both employees and residents in the skilled nursing facilities that test positive that may not have come to our attention without the surveillance program in place. And then we in the hospitals will, the hospitals have relationships with the various skilled nursing facilities in the area. Will work together to do what we've done in the past with the skilled nursing facility here that had COVID-19 patients. We cohort the people who have the residents who have COVID-19, and we make changes to the staffing so that anyone that has COVID-19 who's working doesn't come to work, and we keep the staff in groups so that if there are more cases that occur, there are very small clusters or individual cases and not a huge outbreak in the facility. And the other group that is interested in surveillance would be first responders. And the purpose there would be to identify anyone who's positive without symptoms and get them home and out of the, for example, the fire department, firehouse, so that the exposure ends, and that way our first responders can avoid outbreaks. There may still be individual cases or small clusters, but at least they're small clusters rather than a large outbreak that can take out a large number of first responders. So that's what I'm familiar with. I've had those conversations with both those groups.
Thank you, Dr. Moreno. And another question, since April 14th, about 86% of the COVID-19 cases have been in Salinas and South County. Is the increasing number of cases a result of the virus spreading among residents in those areas or the result of increased testing? And if the virus is spreading in those areas, what could be the reason for that?
So I think it's a combination of increased testing. We have first of all, we have two Optum sites located in the Salinas and South County area. And for the last week and a half, 2 weeks, due to a lot of outreach and education and promotion, and we've had a lot more people utilizing those testing sites. And so we've had, I think that's contributed to increased number of cases that we've seen here in Monterey County. So we're still very grateful. I'm very grateful to California Department of Public Health and Dr. Charity Dean for affording us those two sites, and then the sites in our neighboring counties as well that serve as a resource to Monterey County. So that's one reason. The other is and the location, having them and locating them in those areas. I think the other is that we do have a lot of folks living in Salinas, which is the county seat, a larger population, more dense population, and more people seeking testing. And then finally, as I mentioned, there have been some gatherings, social gatherings, which also increases transmission of the virus. And again, these are family gatherings and people want to see each other, but if you're not from the same household, you may be from the same family, but if you're not from the same household, you run the risk of spreading COVID-19 and getting people infected. And then finally, and I'll end with this one, although we have moved on with allowing more businesses and activities to occur with modifications, which like covering your face and social distancing and staggering people coming in and out of businesses. There's still that opportunity as we get out more and do more things and provide more services and go out to seek more services that we hadn't for the last 2 months. There's still some opportunity for transmission of the virus. So there's a variety of reasons why, but I just want to say that as we move forward and allow more of these businesses, more of these activities, we did so with data. Data showed that our doubling rate indicated that we had significantly slowed the spread of the virus, and that more people were using covering their face to protect others. So we were ready. It was the time, and I'm glad we were able to get to where we're at right now.
Thank you, Dr. Moreno. And another question, what is the total amount of cases that we can see where you would consider scaling back the reopening of businesses here in the county? Is it based on consecutive days? And if so, how many days of what particular number of confirmed cases?
So as we submitted thank you for the questions. We submitted our attestation to the state. We agreed to look out what we call the 14-day cumulative incidence per 100,000 population. And it's one of 9 or 10 exactly, indicators that we agreed to look at. I can tell you that, so for that's one. We look at that, we look at all the other 9, and we'll look at what's going on locally and what's going on in California. And so at this point, most counties have attested and had their attestations posted on the state website. So a lot of us now are working closely with the state health officer and looking at each of us are looking at our indicators, and the state is also looking at the indicators with us, and what they're doing is looking at across the state how are we all doing with our indicators. And so the indicators aren't hard and fast point where if we get there, we have to close restaurants, or we get there, we have to shut down parks. It's more of this is one of many indicators that we're going to be following. So I'll end by just saying that it is important that we and other counties in the state follow indicators, because this is how we made the decision to go ahead and allow more businesses and more activities to occur. We looked at the data and over time and looked at the indicators that showed that we had been relatively successful here in Monterey County. So this is the same type of data that I think we need to continue to look at. And if the state and I and other counties get to a point where we think our indicators are very troublesome, then at that point, and I can't tell you when that would be, but at that point we would be having conversations with, I'd be having conversations with Charles Mckee and the Board of Supervisors and our colleagues at the hospitals who might be seeing more hospitalized patients or people who are dying. We'll have conversations with a lot of different organizations to decide on what the most appropriate step is to allow some continuing of the businesses that promote our economy locally, but also protecting public health.
Thank you, Dr. Moreno. And I'm going to jump down briefly, a little out of order, because I have a question for Diana Jimenez, and it's a simple one. Hoping, Diana, that you could repeat the names of the cities that the restaurants are located in.
Sure. Salinas, Prundell, Gonzales, King City, Monterey, and Marina.
Thank you. Thanks very, I think we were all scrambling to write them all down.
If I can add that the city of Seaside has their own Great Plates Delivered program. They applied with the state and were approved, so they have their own.
Great, thank you very much. Now we'll get back to some of the COVID questions, and here's one for Dr. Moreno. Your April predictions on the number of COVID-19 cases and hospitalizations in Monterey County was based on the idea that 70% of the county's residents would practice social distancing. Has the health department determined what percentage of county residents, since your prediction, have been practicing social distancing?
Okay, so sure. So when I presented to the Board of Supervisors, I wasn't predicting how many people were going to be hospitalized. I was sharing with them the results of a model from a university that had been used by various counties and states across the United States to get some idea of what a surge would look like. The model requests, or in order to complete the model and get the results, we had to put in an estimate of compliance with social distancing. So we don't have a way to measure social distancing. And so we did what we put in a few different scenarios of different percentage of success with social distancing for that. What we do have is actual data, and as I mentioned, we have the numbers of cases. We can track doubling rates. We can look at things like how much on the bed census and how many people with COVID-19 infection are hospitalized on a given day, and average that over time. And so those are things that we're following. And because we've been able to social distance satisfactorily, not knowing what percentage of people social distance or don't have a measure of success of the actual social distancing, we have indicators of the impact of social distancing. And so we're tracking those indicators. That's actual data that we're using, and we will be continuing to use the actual data as we move forward.
Thank you. And then we're still seeing spikes within the ag industry in Salinas. Are there efforts being made to protect our ag workers?
Yeah, so well, actually, I can start unless Charles Mckee wants to step in, because I think Charles has been working with the Ag Commissioner and advocates on a regular basis. Charles, do you want to, or shall
I can start, and then you can fill in.
Okay, sure.
See if I can get this up. So yeah, there are a lot of efforts going on, both statewide and here locally. I think everybody knows about the protocols that were put in place by the agricultural industry here with the assistance of our agricultural commissioner, our members of the Board of Supervisors, Lopez and Alejo, and as well as the Farm Bureau, Grower Shippers Association, Vintners and Growers Association. And they were a model that have been replicated elsewhere throughout the country, from what I understand, and especially throughout the state. And those protocols have also been updated and revised regularly, looking at ways to improve the protocols for protecting the farm workers. We also have asked the state to make sure that they're providing additional PPE if they can for our workers, but we also know that a lot of the companies here are providing the personal protective equipment for the workers. I can't guarantee, obviously, that everybody is doing that, but we know that a lot of that is occurring both in the fields and in the packing facilities, the cooling facilities. With that said, we also know that there's a lot of need to continue on these efforts, and so what we're doing is collaborating regularly with a farm worker coalition group to look at ways to improve getting the best practices out into the farm worker community. And some of those efforts have resulted in making sure that we had 2 of those Optum testing sites here locally, and encouraging testing as we have. We are, the Salinas and Greenfield sites are 2 of the highest performing Optum test sites in the state, from what I understand. So we've been pushing that out. And through the efforts of all the organizations that I mentioned, I think that the educational piece has been phenomenal. We also know that on that issue of education, our local hospitals have stepped up to go out into the field to help educate our farm worker community, our agricultural community, to give that hands-on advice on what, how people can protect themselves, how farm workers can protect themselves, and it's been a well-received project in collaboration to get that information directly from the healthcare professionals. So I hope that covers it, and I don't know if Dr. Moreno has anything he would add.
Yeah, thank you, Charles. I mean, you always do a great job of explaining all the ways that we're working with our advocates and other agencies to protect farm workers. The only thing I'll add is that we continue to periodically, we continue to get calls from hospitals who have a farm worker who's in the emergency department who's not sick enough to be hospitalized, but because some of the hospitals are testing for COVID on site, they test positive and they've got the diagnosis before they are discharged from the emergency department. And we get those calls, and we get calls from discharge planners and case managers from hospitalized patients with COVID-19 who are farm workers who are living in with roommates in crowded dwellings, and asking if there's anything we can do to assist with getting them out of that situation so they can isolate and finish their isolation away from the roommates who sometimes are also farm workers or just families of the family members of the farm workers. So we still make those referrals to Office of Emergency Services in the Emergency Operations Center, who can, in most instances, find a place to house that person and get them transported safely over to one of the places the county has an agreement with to finish out their isolation.
Hey, thank you, Dr. Moreno, and thanks for raising that point about the housing, because 2 things I would add in is that we're working closely with the Grower Shippers Association to provide housing to farm workers, both the what are called H-2A workers, or workers coming from out the country, as well as some of our domestic farm workers here, to provide housing, as Dr. Moreno articulated, in those circumstances when they need to isolate. And one of the key points there I would add in is that you know, originally we were informed by the state that you know, that reimbursement would not be available under their different programs for housing of farm workers in these situations, because they didn't qualify as, quote, homeless. And we pushed back and made the argument that if you are cannot isolate at home and you don't have, or you need to be somewhere else, and you don't have the ability to secure other housing, you know, at that point you are homeless. You know, you're without a home, and it's no different than any other disaster situation, emergency situation, fire or flood, when you're forced out of your living situation. And so we wanted to make sure that we're doing what is right to both protect the individual who might need housing to isolate themselves, and also protect our overall community.
Thank you, Charles. And then Dr. Moreno, here's a question on predictions. Does the increasing number of cases in the Salinas and South County area portend a summer or fall surge, in your opinion? And you're on mute.
Let's see. I would say from right now, it's too early to say whether or not the increase in cases in the Salinas and South County area represent a trend that's heading towards a peak, or rapidly towards a peak. What I can tell you is that we continue to see increased cases, but because the doubling time is still 3 to 4 weeks, the rise in the number of cases on a day-to-day basis is still steady. So we're in a pandemic, so we're going to continue to see cases. What we're really trying to do is try to slow down the number of cases because there are some people who, if we continue what we're doing, we can delay them from getting exposed to getting COVID-19 until we have more, till we get to a place where we have more therapeutics, more medications to treat COVID-19, and hopefully delay some of these cases until we have a vaccine and we can protect people, particularly people who are really susceptible to dying from this virus. So too early to say at this point, but I am somewhat reassured in that the rise in COVID cases continues to be steady. It is not increasing exponentially, which would represent that the spread that the virus is spreading much more faster. So I think we're still okay at this point.
And then regarding model projections that you've spoken about, will you be doing an updated model soon, similar to the presentation that was provided, I believe, last month to the board?
Yeah, I'm not sure that we're going to be doing one, and if we do, when we're going to do that again to the Board of Supervisors. Is that because what we saw from the University of Pennsylvania model was that even with some social distancing, the rate of increase of the cases the rate actually increases. So meaning that the virus starts to spread faster and faster. And what we've seen for the last 2-3 months is that the rate of spread is not rising exponentially, it's a steady increase. And so doing a model now while we have a steady increase probably isn't going to help, because we don't have really much information to show that we're going to have that exponential rise at this point. So I'm not sure that we're going to be giving one soon, and if we do, when that would be. But thank you for the question.
Yes, and last week you spoke about clusters coming out of Mother's Day gatherings.
Mm-hmm.
The question here is, how many possible cases could have come out of those gatherings? Do you know?
Yeah, I can't estimate how many. What I do when I do mention those, I'm speaking more anecdotally, and this meaning that I check in with our folks, our team that are doing the case investigations and the contact tracings to find out what are some of the situations that they're experiencing when they start calling people and finding out who they're exposed to. And so I don't have an estimate of that. It's more anecdotally, and I think it's important to at least have. It's often helpful to even just have anecdotal experience to share with people so they can understand what type of scenarios we're seeing where virus is being transmitted. And so I want to share that with everyone today, just so that as a reminder that we do have experience now with people who are, again, from the same family, but they're different households. They live in different homes, but they come together as a family, and that doesn't somehow protect people from exposing each other to COVID-19. So I just want people to be aware of that and continue to practice social distancing with people who are not from your same household as much as possible.
And you mentioned contact tracers in your last comments. I have a question about how many contact tracers do we have right now?
Yeah, I know we, last time I spoke with Christine Mishi, I think she said we have over 40 contact tracers that have been trained. And we're also going to be starting with additional training from the state. So we had a call with the California Department of Public Health, and we are now in line to start receiving this additional statewide training. I think it's I and my colleagues are grateful for this, and some of my colleagues, fellow health officers, actually helped put the training together. And what this allows in California is for our workforce across the state, our workforce that includes case investigators and contact tracers, who are doing a great job right now, to receive one unified training, so that we have across the state a workforce that not only is doing a great job, but they're also implementing the same protocols and tools and interviewing skills to reach out to people who've been exposed and get them in quarantine, make sure that they don't in turn expose other people. This is going to be it's helpful now and continue to be helpful in the next few months as this pandemic goes on. But as a state, I think we've taken another big step in our public health efforts, in that as pandemic hopefully winds down, we will still have outbreaks of measles, outbreaks of hepatitis from people, primarily people who refuse to get vaccinated or vaccinate their children. We will still have these outbreaks, but when we have these outbreaks, if it's a large outbreak in one community or one county, we then have people who are trained in different, trained similarly on the same type of skills and interviewing skills, that we might be able to help each other out. So if San Benito had a big outbreak, we might be able to have our folks who are trained similar to their in interviewing skills, we might be able to help each other out. So it's a big step I think we're taking. And we're also, the state continues to pilot and slowly roll out the statewide data system for contact and contact tracing here in California.
Thank you, Dr. Moreno. And I have a question about the community testing sites. And I'm not sure if you can answer this question, but are community testing sites experiencing any problems with lost tests? And if so, how many and how often does this happen?
So I've not asked the state or OptumServe about lost tests, but I haven't received any reports from my staff about lost tests. If there were lost tests, then we would. Then I'm not saying there aren't any, but I just hasn't been brought to my attention in the reports from my staff to me. But there are periodic delays in test results getting back. Doesn't mean that they're lost. What happens typically is if the hospitals and OptumServe and Planned Parenthood and some of the local providers are all sending test results over a few days at the same time, for whatever reason, the volume will definitely lead to a delay in turnaround time for the commercial labs. So that's not necessarily lost test results or specimens. Those are just delays, which might seem like maybe something got lost or something didn't work right, but they can get backed up if they get a lot of specimens submitted at the same time.
And here's another data question. Positive cases are increasing, but so is testing. Is our county's positivity rate also increasing?
So our positivity rate has been going up and down between 5 and 6%. And there's a little bit of a bump. It's getting closer to 6% right now. And the positivity rate is okay. So positivity rate is if we take the number of positive total number of tests that were submitted, and among those tests, we look at how many were positive. Then we take the number of positive divided by that larger number. That's our positivity rate over a period of time. One would expect the positivity rate to go up when more people in Monterey, or a larger proportion of people in Monterey County, are infected with the virus, or we're beginning to see a more rapid spread of the virus in the community. So at this point, we haven't gotten above, I don't think above 6%. It goes up and down a little bit, but I think right now we're still pretty steady on that. So what that means is that if we had a 5% positivity rate 2 weeks ago, and those people, almost all those people got over their illness, and then 2 weeks later we still have 5% positivity rate. It means that at any given time, about 5% of people who are getting tested are positive. But if we go from a 5% positivity rate and then a few weeks later to a 10% positivity rate and then a 15% positivity rate, that could be an indicator that the virus is spreading much more rapidly than in the past, and that would be concerning. So at this point, I'm still pleased that even though we have 5% of people testing positive, at least it's still only 5%, which means that it's still spreading relatively slowly, giving us time to slowly implement more activities, more businesses with modifications, and giving us as a nation a little more time to come up with more remdesivir and possibly other therapeutics that can shorten the illness and decrease the mortality rate associated with COVID-19 from hospitalized patients, and eventually a vaccine.
Thank you, Dr. Moreno. And what would need to happen to get Monterey County to stage 3 of reopening?
I could answer that, but I think maybe Charles wants to answer, but I'd be happy to give it a shot.
Either way, I mean, my first point would be that it's all about the state, and when the state says anybody can move to stage 3, it's going to be the criteria that the state sets forth, and they haven't pushed that out yet. There are guidelines for different industries, and I don't know if any of those are within stage 3. But even if they're guidelines, you still need to wait for the stage 3 opening as the state might allow. I'm not aware yet, I don't know if anybody else is, whether the state will go through stage 3 the same way they went through stage 2, which is to say allowing variances based on attestation, or whether they'll use some other model.
Thank you. And for Dr. Moreno, what general surge data are county health and others using to plan for a response? You're on mute.
So what surge data are we using?
Yes, to plan for the COVID response.
Yeah, okay, good. So in terms of surge data, there's the surge data from cases, and then there's surge, the ability to handle surge. So in terms of the cases, the indicators that we submitted with the attestation to the state are the indicators that we'll use to identify a surge in cases should it occur. Surge meaning a much more rapid rise, an exponential rise in cases that leads to a high number of people infected with COVID-19 and hospitalized at the same time, or over a short period of time in the county. So that's the data that's the data is going to be used to develop we are following the indicators which rely on the data, and so those are on the website, and people can look at how we make those determinations. Then there's the surge data in terms of capacity in Monterey County. So one of the things that we agreed with the state on was how to estimate our surge capacity in terms of beds. So what we did was we looked at the at a point in time when the hospitals had postponed or delayed elective surgeries, or at least surgeries and procedures that could be delayed, and then looked at their hospital census at that time. And we in the state agreed that that would be our baseline. So if the hospitals want to start scheduling more elective procedures and no longer delay other procedures, the hospital census is going to go up. But the state and we recognize that at any given time, the hospitals could cancel those procedures and we'll get back down to that baseline. So that baseline is where we start. And then the hospitals share with us how many additional beds they think they could put patients in and staff. And so the difference there is our surge capacity. And so we have enough surge capacity, and the state agrees, to deal with the surge should it occur. And that was one of the criteria of us moving on to the rest of stage 2, knowing that even though the hospitals are going to start filling up more beds with elective patients with elective procedures, we can always go back to that baseline and reopen those beds for a surge in specific COVID-19 patients who need hospitalization.
Now, I would add 2 other points to that. Sorry, Maya. One is that, there's surge capacity in beds, as Dr. Moreno was talking about, and ICU and equipment. And there's also the other criteria that the state put out as far as being able to attest and moving through stage 2, that included making sure that our skilled nursing facilities had, the PPE on hand for a certain number of days, making sure that we had enough bed capacity in motels or alternative sheltering sites to handle a certain percentage of our homeless population, and other criteria like that the state pushed out that we could use as kind of some guideposts to make sure that we're prepared. And it's kind of in addition to any, the way that we might be looking at numbers. We need to make sure that we're hitting those metrics.
And I hate to re-ask this question, but the reporter was surge date. The reporter question was, what surge date is the county and health using to plan for a response? And this goes back to the surge timing question that was asked by somebody else. Do we have a a more specific time for the surge.
Right. Okay. So surge date. So we don't have
Yeah, my bad.
no problem. So no, we don't have a surge date at this point. We have a steady increase in COVID-19, which I hope that we can, as a community, we will continue to work together to keep that increase steady. And so if we have that, then we will get to a place where we have more cases, but the number and more hospitalizations at some point, but that will be manageable by our hospitals, and our hospitals will have enough PPE and other resources to manage that. So no, we don't have a surge date at this time.
Thank you, Dr. Moreno. I have a question about, has anyone been sent to the county's alternative sites? And that the answer to that question is no, and I can provide more information if you want it. And then
let me
Go ahead.
add in on that. So yeah, so a couple things with the alternative housing care sites. No, the alternative housing sites, the same thing. No, we're not. Neither one has been needed at this point, which is a great testament to the compliance that we've had locally. And with the alternative housing site, we knew we needed to set up quickly and have them available. And they're in a pattern right now where we can ramp them up if need be, but we're not they're not open right now in the sense of people going there, but we can move them into that open capacity quickly if we need to. In addition, we knew that the hotels, motels were something that we needed to look at, but we had to work through some of the challenges that they had and concerns they had with having potentially COVID positive guests at their hotels. At the same time, we knew that some of the hotels, motels wanted us to book large wings of their hotels, if not the whole hotel, which would cost a significant amount of money, and we had to work through that challenge also. And then also knowing that we want to make sure that our local businesses, hotels, motels, were able to get, we wanted to be able to use their services, and if we could, before using some of the alternative housing sites. So we wanted to make sure that those businesses were able to benefit from the money that we were spending on setting up alternative housing sites by using the hotels, motels. So that's a long-winded answer of saying that we don't have anybody at the housing sites or the care site because there's no need, because at this time we've been flattening the curve. And then in addition to that, there was one other question in the chat about how many hotels, motels are available for farm workers. And what I would say is that the Growers Shippers Association has a few hotels, several hotels, and many rooms available. And the county has, I think, over 8 or 10 hotels at this time, but I wouldn't say it's available for just farm workers. It's available to use to house people who cannot isolate at home and need to be isolated at this time.
All right, thanks, and thanks for answering a couple questions at one time. And I apologize, we are over our hour. We did get started a little bit late, but that will wrap up our media briefing for today. I have a question from KZU about confirming the doubling rate, and I'll get that and send it out to everyone. Thanks for joining us, and we'll see you at our next briefing on Friday.